I'm the team lead for the primary care mental health nurse service in Stirling and Clackmannan. We started in 2015 with 4 nurses in 2 GP practices, but we now have 29 nurses across 52 GP practices. We offer short-term evidence-based interventions for mild to moderate mental health difficulties, including things like stress, anxiety, low mood and suicidal thinking. So when you phone your GP practice, you can ask for the mental health nurse directly and reception can book you an appointment. If you don't give an indication of why you're phoning, then the receptionist may ask to try and ensure that they place you with the best person. At that point, you would likely be given a routine appointment within the following couple of weeks. The process for this will vary slightly depending on the practice, as each practice will manage things differently. When you get your appointment with the primary care mental health nurse, we will start by doing an assessment with you, and we will base our treatment plan on the stepped care model. We take a very person-centred approach by trying to match the patient to the best step for them, and we will do this in consultation with you. Following assessment, we would start with some psychoeducation, which would include education around your symptoms and how they're affecting you. From there, we would move on to self-help, which we can support, and beyond that, we are able to refer into any other area of mental health services if that's required, including secondary care and crisis services. We aim to offer these interventions on a short-term basis. However, we do work in a very similar way to the GPs, and so if you ever felt that you were having difficulties again in the future, then you're more than welcome to make a return appointment. We're seeing the right people at the right time, and very few patients are referred back to the GP for further care. Our most common outcome of primary care mental health nurse appointments is self-help, and this includes things like psychoeducation, guided self-help such as offering signposting to the right resources, goal setting, or providing tools and strategies for people to manage their own health and well-being. We're also able to review medications and either prescribe or arrange prescriptions for patients as required.